This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
I thought we could do a quick little medical minute on electrical burns. So I just did a little bit of review on it, and saw that electrical burns compose about 2 to 9% of all burns that come in to the emergency department. Maybe not so surprisingly, guys make up the majority of it. About 85 to 95% of patients that have electrical burns are males, usually 20s to 30s, and often actually occupational, which also is not so surprising. And then also you'd figure that the upper extremities are the most commonly injured body part. As far as diagnostics and management, there's only a couple of important things to consider that are a little bit different in the burn world from electrical burns, and the big ones are just going to be, is there any cardiac effects? So really, are there any dysrhythmias that may be secondary to the electrical current that went through them? And so getting a screening EKG is always recommended, looking for signs of dysrhythmias. They can have PVCs, they can have blocks, they can have sinus tach or SVT. Worst case would be some cases of ventricular dysrhythmias. The other thing to consider is they can have underlying muscle damage that is not so apparent on the skin. So we consider compartment syndrome and rhabdomyolysis as other issues with electrical burns. So getting that CPK and doing good just assessments of the compartments is all that's really recommended for that. So still ABCs, still standard burn care. Just remember the electrical effects on the heart and consider the underlying muscle breakdown that can be associated with it. One other thing, I just mentioned this because I think it helps me think of electricity a little bit better, is that, electricity and fluids are kind of similar in that, they both have current, and the way you can think about voltage is similar to pressure. So it's like electrical pressure is voltage, right? So just if you're thinking of something as being high voltage, what does that really mean? That's like basically saying it's like really high pressure electrically. And what's more concerning for a person is the current that's going through them than the voltage per se. But just a little pearl about that, just so you can think about it. That's all. Is there any questions or anything about electrical burns? Yeah.
On our guidelines, it just says for a burn activation, high voltage electrical burns greater than 1,000 volts, including industrial high tension electric power lines, lightning.
Yeah.
Is there any other ones that are major? Because I don't know the voltage off the top of my head. Is it mostly just those two, or are there any other situations that would be that one would be an activation?
I don't.
Any situations you've seen?
I think of those some pretty comprehensive. Okay. Yeah.
Cool.
And those, and like I just mentioned, the current is what matters, but it's just when you have such high voltage, it's implied that you're going to have such high current with those two. But yeah, no, those sound pretty legit. If one comes up that's not on there, we'll make sure to add it on.
Okay, cool. I don't know.
If EMS says that the guy got hit hard, you just pay me.
Yeah.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.